Welcome to Mom in Mind, a podcast about maternal mental health, discussing conception, pregnancy, birth, and postpartum. Real stories from moms and family members who have made it from struggling to wellness, and interviews with experts and advocates who work for moms and families to get the help they need. This podcast is meant to offer information and awareness and is not a replacement for treatment by a professional or professional training. Hi, welcome back to Mom in Mind. I'm your host, Dr. Kat. One of the important pieces of understanding perinatal mental health is putting it in context of culture, immigration, and other socio-cultural factors. And I do believe, as we have seen and have seen myself, that when we use the culture to inform healing, a depth of relief and understanding happens. As a part of the Mom in Mind podcast, I really want to address this as much as possible, which can take a while. It may take a while because there are so many different facets to culture and different cultures to understand. But my personal perspective is that motherhood is sort of defined by culture, and parenthood is shaped by the culture that we are in. And that can be anywhere from the country you live in, to the state, to the city, to the part of the town that you live in, to the family you grew up in, to the school you went to. Any number of things that has shaped you throughout your life, or has shaped a mother, father, parent throughout their life, is going to be impacting how they parent or in how they experience parenthood. And so today we're going to learn a little bit more about that from the perspective of Dr. Kendra Flores-Carter. And she's here to discuss perinatal mental health from the lens of Carribean mothers. As we've stated on previous episodes about culture, there are many, many different cultures within the Caribbean and with any specific group we're discussing. So this is not meant to be specific or prescriptive on what to do for each and every person from that culture, but rather to inform us and have this information to keep in mind. Dr. Kendra Flores-Carter received her BA in psychology from Cal State Dominguez Hills, her MSW from Cal State Long Beach, and her Doctor of Social Work from the University of Tennessee, Knoxville. She currently works as a maternal, child, and pediatrics associated clinical social worker. She's a proud researcher in the perinatal mental health field as well. Dr. Flores-Carter received her certificate in maternal mental health training from Postpartum Support International and now works as a maternal mental health expert. She's a member of the Arrowhead Regional Medical Center Institutional Review Board and has several research projects in the works. She's done many trainings and presentations related to topics of maternal mental health. Dr. Flores-Carter currently serves as a co-chair of the Inland Empire Maternal Mental Health Collaborative. She's an active member of Postpartum Support International and facilitates a free monthly postpartum support group for women and families on site at Arrowhead Regional Medical Center. Dr. Flores-Carter was a recipient of the 2016 ARMC Employee Recognition Award for her efforts and work to improve maternal mental health care at ARMC and within the community. She also received the 2017 Golden Ida M. Cannon Award for her work to bring awareness and education on maternal mental health concerns to ARMC's Women's Health Department. So let's meet Dr. Flores-Carter. Welcome, Dr. Flores-Carter. Thank you so much for being with us.
Oh, thank you so much for having me. I really, really appreciate you giving me this platform to really talk about the experience of Caribbean moms within the United States.
Yeah,
I really appreciate you.
Yeah, and I appreciate you. I'm getting to, after having gotten to know you over the last several years and our work together, I really value your perspective, and I'm excited that you're bringing this specifically to the forefront now and starting a conversation about Caribbean mothers. I just think it's so needed. And so we'll get into that in a little bit, but how about you start off with telling us about the work that you do now?
Okay, well, currently I work for a hospital in the San Bernardino County area. I am a maternal, child, and pediatric social worker, and I've been doing this work for about 10 years now. And I work in the women's health department, and I address a lot of the times women who struggle with maternal mental health concerns and, issues surrounding giving birth and issues that they have during their pregnancy relating to their mental health. So I just really am glad to be in an environment where I can really provide education resources and pretty much bring awareness to this very significant concern that many people really don't really talk about, especially within our community. It's really something that I don't think anyone ever brought up to me when I was a mom. Well, when I was, pregnant, no one talked to me about mental health. So,
Right. And just to also let people know a little bit more, about the work that you do that I know of is you've really implemented a lot of stuff within the hospital and pushed pretty strongly for there to be more advocacy and screening and for people to be given information that they do need, maybe in part because how it feels to not have the information, but also because you're such a strong advocate for moms. It's really amazing what you've done there.
Oh, thank you so much. I just a few years ago, I really wanted to provide the education because even from my own personal experience, when I had my very first daughter in 2008, I don't remember ever being asked about maternal mental health concerns or depression or anything like that. Right. I went in, I gave birth, and I left, and there were no resources. And the more I learned about maternal mental health, the more I wanted to do within the hospital setting for my moms and for my patients, because when 1 in 7 moms are going to experience this, when we're a hospital that has 300 births on average per month, then that puts a lot of my mothers at risk for a maternal mental health concern. So it was very, very important for me to implement something in the hospital that would address maternal mental health. So now all of our mothers get the education before they leave, and it's a mandatory part of their discharge planning is for us to provide education and give them resources before they walk out the door.
Oh my gosh, that is amazing. That is just amazing. You've done such good work. It's phenomenal. Congratulations on all of that. So, and just the benefits that all the moms are receiving because of this education. It's just, you're lifting an entire community by giving them this information. It's amazing.
Yeah, and it is really amazing. And my patients are so grateful because many of them, they do come back and they're like, oh my God, you didn't do this like 2 years ago when I had my son here, or it's so amazing to see you're doing it now.
Oh, that's great. Oh, that's so nice. So let's now get into talking a little bit more about Carribean Mothers and what you've seen and things that you understand about the maternal mental health concerns and those cultures, I should say.
Yeah, when we talk about the Caribbean, we're talking about places like Jamaica, Belize, where I'm from, Aruba, Barbados, the Cayman Islands, Guyana, St. Lucia, St. Kitts, Trinidad and Tobago, and the list goes on. So there's a lot of people in the United States from those specific countries and other Caribbean countries.
Yeah.
And oftentimes, we kind of get story with Black Americans, but little do people know that we're different in so many ways as far as our cultures are concerned, and our language is a little bit different, and for me, I speak Creole, even though the official language is English. There are some moments where people might not understand what I'm saying. Mm-hmm. And the same thing with, for instance, someone from Jamaica who speaks Patois. It's a lot different than the American English. And so that could be sometimes barriers to where people don't really reach out, or they're a little bit more reserved in asking or seeking any type of help because they're like, are they going to understand what I need or what I'm asking?
Are you speaking just specifically from the language barrier or language difference?
Yeah, that as a whole. I have a lot of people that I know that are from the Caribbean that are really even afraid to ask questions in the grocery store because they wonder if the people are going to understand what they're saying. And so when I think of mothers in a hospital setting, are they really going to be more quiet and not really want to speak up because they might be a little bit afraid that, man, they're probably not going to really understand what I'm saying because, I speak a dialect and I don't know perfect English. For many, that still is a struggle. For many people, the perfect English is really difficult.
So. Wow.
Yeah.
Okay, so that's one of the challenges. I mean, there's so many different cultures that we're kind of, for the sake of the conversation and bringing attention to the issues, kind of lumping a lot of different cultures into our discussion. But I appreciate that you're differentiating that there are differences across islands and across the Caribbean.
Yeah, they are significant differences. And, oftentimes, I mean, if I don't really open my mouth or speak and no one hears an accent, they just assume that I'm African American, and I'm not. And it's just like that for a lot of my other friends too. They're like, well, I'm Jamaican, but people, they think that I am African American as well, but we really are different. Our culture is different. The foods we eat is different. The traditions different. And so we assimilate a lot to the American culture, but we're still rooted in who we are, because that's what we grew up in. Mm-hmm. And so it could get lost. And a lot of the times our identities can get a little bit lost and confused, especially as it pertains to becoming mothers in the United States.
So, wow. I mean, I feel like we could have a full episode just on that. And then also, as you're talking, I'm thinking about, and something that you brought up before we started recording is, different cultural beliefs about maternal mental health. So, there's not a ton of research here in terms of understanding, like on paper and statistics, how this is affecting women differently. But that there are cultural differences. So what are some of the cultural beliefs about maternal mental health that you're aware of?
Too many times we as Caribbean people, we see mental illness as a whole as something that has to be severe. Like it has to be severe and not necessarily like, subtle. And, when we're experiencing depression or symptoms of anxiety, those symptoms really sometimes just become like a normal part of existence. And, women don't see it as them experiencing a maternal mental health condition such as postpartum depression or postpartum anxiety. They tend to look at those struggles as a normal part of motherhood. And it has a lot to do with our cultural belief that we really have to be strong. Mothers are looked upon as the person that really can do it all within the culture. You are put on this earth to procreate. I hear that word a lot.
Oh, yeah.
You procreate. That's why God made you, to have children and to really be the nurturer and really take care of these babies. And so when challenges come up and we're feeling overwhelmed, we really just don't say, okay, let me go out and get the help because this is not normal. Because oftentimes you just think that, it's just a normal part of being a mom.
Mm. And that would be even more challenging just being in the United States. Well, are there other supportive practices like for you, or for people that that people would normally be calling on in terms of support that they can't get here or aren't getting here?
Oh, yes. I mean, when we're back home, you have auntie, grandma, mom, everyone coming to help you when you go home after you've just had a baby. Out here, it's like everyone has to work in the United States. We all got to pay our bills or rent or mortgages, And so a lot of the times the help that you would get if you were in your home country is a lot different from when you're here in the United States. I mean, for me personally, I spent, after the birth of my son, I spent 2 weeks at my mom's, but I really wish I could have probably be there the whole, my whole maternity leave.
Yeah.
But of course, everyone has to get back to their work. Everyone has to get back to their lives. And so a lot of the times as Caribbean women, we have to really, assimilate to how the culture is out here, which is you get back up and you do what you have to do. And your problems really, you have to stick it through. And whereas back home, you probably have a lot more support if you were going through postpartum anxiety or depression, or, you were experiencing something where you're tired and you need some rest. someone will come over and watch the baby for you so that you can sleep. It's a lot different here.
Wow. So, right, there's just not the same amount of support.
Yeah.
And are you hearing that from other people that you know who come from other countries in the Caribbean?
Oh, yes. I hear that from a lot of my Caribbean friends. I mean, I have a very close Jamaican girlfriend, and she has her mom come whenever she have a baby, just
Right.
to come from Jamaica to help her for that period of time. I remember when my mother had my little sister, my grandmother came to the United States to be with her for 6 months.
Mm-hmm.
You know,
Right.
she had that luxury, but not everyone has that luxury to have their family fly from a different country to come over here. You know, the problem with visas, you know, are they going to get a visa to come to be with you?
Mm-hmm.
Do you have the financial resources to have them come out here to help you? Most likely, a lot of people, they really don't. So you really are on your own most of the time trying to figure out to cope and deal with whatever issues you might be having after you've had your baby or during your pregnancy.
Okay, wow. So if in terms of the cultural beliefs about maternal mental health, if what would be some of the things that, like, let's say, again, being very general, a Caribbean mother might be concerned about for reaching out for support?
Well, like with every other culture, there's a shame and there's a guilt for even reaching out for help. There's the feeling that, oh my God, me asking for help, that's like a sign of me being weak. But it's important for them to know that just reach out for help, ask for help, because there's other women out there just like you. And by you speaking up, you're encouraging all those other mothers who feel like they're alone to speak up even more. And I think for me, even doing this and having this platform, I feel like it's so important because it's like a secret. There's people that go through it, but they don't talk about it, or they feel ashamed to talk about it. And it's important for us to really, express ourselves and really talk about what we're experiencing, because as I've grown in this profession, I understand that when you are depressed and when you are, when you have severe anxiety, you're really unable, even though you think you're unable to give your baby what your baby really needs. And I think a lot of the times we think as mom that we are giving our babies everything, but really we're not when we're really overwhelmed and depressed and stressed out. We might feel that we are, but the truth is we probably aren't being the 100% mom that we want to be. And in the end, that could have a negative effect on our babies and how our babies grow up. So it's important that when you do feel that way, you ask for help.
So that you can get back to being that 100% mom that you want to be, like you're talking about.
Exactly.
Okay. So right, the level of stigma and concern. And I think what you were talking about before, just maybe in terms of being, depending on when you got here as an immigrant, how long you've been in the States, how comfortable you are sharing this kind of information with other people. I'm just thinking about the difference between someone who's been here for 20 years, like maybe came as a kid and is having kids, versus somebody who came last year and is not used to this system yet, not used to how things work and how difficult it might be for somebody who's here a little, who hasn't been here as long.
Yeah, exactly. And there's the question of immigration, because a lot of moms are here. They're here illegally. And so, that's a big concern for a lot of people, is that if I reach out, is immigration going to get involved? Am I going to risk getting deported? That's a big concern for a lot of Caribbean moms out here. It's like, it's a struggle every day. And then now I have this added depression or this added, anxiety to whatever it is that I'm going through. And now if I ask for help, then I might have an added stress of immigration. And so that's what hinders a lot of moms from saying, let me go and ask for some help. But what I want to educate the community about is that that is not an issue. If you come to a hospital, immigration has nothing to do with you needing help, and you getting the help that you need. You can receive emergency services if it's necessary, and that has nothing to do with whether or not you get deported. And I think for a lot of people, whether they're here, long or they just recently came, they still kind of have that mistrust for the medical system and the behavioral health system because of that particular, barrier for immigration.
Right. So you're not asking people right away, are you an immigrant and are you here legally or not? That's not something you're asking in the hospital. No.
No, that's not something you're asking. And you're gonna probably ask them if they have medical insurance or anything like that. But if they don't and they really need treatment, it's not gonna be a barrier to say, well, you can't get help if it's an emergency. There's, they're not gonna do that. Like for me, I worked within the county system at a county hospital, and if you come here and you need help, they're not gonna turn you away because you don't have insurance. Right. And for the most part, moms who are pregnant, they automatically qualify for Medi-Cal insurance, and they have that after the postpartum period,
whether they're legal or not.
Yes. As long as you're pregnant, you automatically qualify for insurance.
That's such important information to give people. I mean, you're speaking to that fear that just lays on top of all of this other stuff you have to worry about already. Hopefully somebody who's hearing this can know that there's a safe place to go when they're pregnant is go to the county hospital.
Yeah, exactly. And a lot of people, they don't know that. Come into the hospital. Don't wait until it's when you're delivery that you're coming and get help. Apply for Medi-Cal. You can qualify.
Wow. That's just, that's one of those things that if you're new to the country, it could take years to figure out how the medical system works, because it's difficult for people who've been here for a long time to figure out how it works. And still, I don't even know all of it. So certainly giving somebody that information could hopefully help them a lot.
Yeah, that is the hope that, they know that they can reach out and get the help.
So what are the other culture-specific things that you've seen with Caribbean mothers that either help or make this pregnancy and postpartum more difficult?
I think really and truly there's just the belief that if we work hard and we go through all the adversities or obstacles, we face them head on and we just push through with resiliency, that we're going to overcome all the hardships. There's that strong belief that you just got to push through it no matter what, and you're going to overcome it. So I think that's really rooted in our culture, that we just have to keep going and have this strong Black woman complex. And oftentimes it really prevents us from seeking the help that we need, especially in the times when we are in psychological distress or, we're experiencing postpartum depression and anxiety. We really just feel like we just have to keep going and we're going to get over it. We're going to get over it. And then you have family members, your elders in your family telling you, oh, don't worry about it. This is just a normal part of pregnancy. And that's because of the lack of education on what the signs and symptoms are for mental health, maternal mental health concerns. So it's like, if you have your grandma and your mom telling you it's just a normal part of pregnancy, then you're just going to go through it, Right.
Are there other things that are either supportive or make things more difficult for Caribbean women around spirituality or understanding religion or spirituality in terms of maternal mental health?
Well, oh yeah, of course. We're very religious. A lot of us from the Caribbean are very religious. I mean, I remember growing up into church, every Sunday, every Bible study, we just was always in the church. And I think when it comes to mental health concerns, especially for moms, maternal mental health concerns, sometimes we tend to think that, oh man, maybe I'm not praying enough, or maybe I'm not putting God first in my life enough, or whatever the case may be. Religion plays a huge part in whether or not they feel the need to go and seek services. And oftentimes it can be a barrier to them going, because they're thinking, oh, if I go, do I really believe in God if I go and get help from a therapist? My help should come from the Lord and only the Lord only, because I trust and I have faith in Him. But what they don't understand is God blessed people within our lives and within the community to become more experts in certain things to help you when you're in distress. Mm-hmm. So that's part of the teachings that I really try to give people, is that, yeah, you have your faith and you have your religion, but we don't know it all and we can't handle it all. And God sometimes bless other people with gifts that can help you overcome your struggles. And I think that that's an important piece to take home to a lot of the Caribbean communities, that we don't lose ourselves in God if we go and seek help from a therapist.
That's pretty powerful. I mean, it's a beautiful distinction too, because you're saying it's not necessarily a weakness of character or a weakness in your beliefs to go get help.
No, it's not. It really isn't.
So then in terms of like other maybe traditional practices, and obviously, we can't cover all of the Caribbean and all of the different types of cultural practices, but what do you think? Can you speak to what happens about the cultural practices that people have around pregnancy or postpartum, and what happens when they're here?
Oftentimes a lot of the traditions, they get lost in the trenches, because we have to assimilate to the way the culture is in the United States. So a lot of the things that we probably practice back home, we probably wouldn't do it here, because we don't have access to what we probably need to do it. So a lot of the times we just kind of just assimilate and, have a normal American, probably traditional birthing experience, because it's really a lot more difficult if we're not back home in, like, for instance, in Belize or Jamaica.
Yeah, that just makes me think that for people who are really connected to their traditions, not being able to engage in them here for any number of reasons, like you said, not having the proper things to use for that tradition. I was just wondering how much that would add to how they're feeling. If they're feeling bad already, how much more difficult would it be to not have those practices?
Yeah, I mean, I could imagine probably very difficult for most moms, especially if their culture and their tradition means so much to them and it's so important to them, I remember just when I gave birth that my mom really saying, you cannot go outside, you have to be covered up. I mean, those are little things that I can do here, but there's more cultural things that's beyond just that. There's herbs that they probably encourage us to drink, and just different things that we can engage in throughout the birthing process, and we just cannot do that here because it's so different.
Wow. Oh, that's so sad. I mean, it's, just for people who really want to be connected to their tradition and who feel supported by that, and how empowering and beautiful it could be to be able to engage in those activities that they feel connected to. It just seems like it would make for a better outcome for their well-being, the mom's well-being, the pregnancy, or whatever, at whatever stage they're engaging in these practices that are specific to their home country, or like the strengths of Caribbean women who have immigrated here. What have you seen are the strengths of, overcoming these other barriers as you were describing, and being able to be resilient and get through these difficult times?
Well, I think that just coming together as a community, I think, reaching out to other members that are from different Caribbean countries and just really coming together. And I hope to see that more
Yeah.
as I grow in my career, coming together with more professionals that are from the Caribbean and really creating some kind of network for people that probably are just coming here that are feeling lost in the system. They don't really know how to navigate. And
Right.
even just being here, just being able to provide support counseling to people that really might not feel comfortable going to someone who they feel does not relate to their struggles as immigrants.
Mhm.
And, just having that support network and just being there for people is really important. And that's definitely something that I would like to look further into because I think it's important. Most likely, we see that there's health out there, but people really strive so much better when they are within a setting where they feel comfortable.
Yeah. Yeah. So bringing people together could really provide the support that they need. What, if any, positive changes, have you seen within the Caribbean, any Caribbean cultures that you're familiar with?
Well, I can really speak on my culture. Being a Belizean mom, I have seen where more people are now really talking about their experiences with depression and with anxiety. And I think that that's an important piece. I've also seen where Belize as a whole is really making a presence, for instance, in the Los Angeles area.
Mm-hmm.
And I think that's important because for the new Belizean moms that are coming to the United States, at least seeing that they can have some sense of home in Los Angeles
Yep.
with them, knowing there of Belizean people out there who are really welcoming and encouraging them to, really kind of keep the culture as much as we can, even though we're not there. Try to keep it as close to home being in LA as possible,
That's right. Yeah, that's right. I mean, just as a side note, my mother-in-law is Belizean, and my in-laws, part of them are Belizean as well. And I've seen, just since I've known them, I've seen some of the community grow, or just even having more places to eat with the food you like, and the food that's like from home is so important.
Yeah, I mean, that's an important piece. I mean, I have my cousin right here visiting me, and she's like, you know what, I want to make some Belizean food because we've just been eating American food. And then she's been here for a few months, but she's like, I want some authentic Belizean food. So, I'm going around trying to find or plantains and, like the different foods that we can cook to bring Belize home.
Yeah.
But, that's important. Sometimes you just want a meal.
All right.
That make you feel like, okay, yeah, this is me. This is who I am. This is my culture. And it feels good. It feels good.
Yeah, that's awesome. Well, hopefully, like you said, that can keep expanding and community support can grow. I mean, I just, even just you talking about this with us today and giving a perspective and having us think a little more deeply about Caribbean women and what it might be like for them as an immigrant here, and needing and wanting to be connected to their roots and their culture. It's so important just to be in our awareness. So I really thank you for doing that and for sharing your experience and sharing the work that you do.
Oh, I'm so happy to share it. And I'm really appreciative of you giving me this platform because I definitely want to grow on it and really encourage just the Caribbean community as a whole. Just reach out for help. There's people here that can help you. If you want to get a hold of me, I'm able to provide support that you need. You can find me on Facebook. Or
I'll put all your stuff
anywhere, up. And Mom and Mind, you guys could find me now. So, I'm more than willing to provide education to my community, the Caribbean community, because I think it's so needed. It really, really is.
It is. Thank you for all of your work and for being on with us today.
Oh, thank you for having me.
Thank you again, Dr. Flores-Carter, for starting this conversation on Caribbean mothers and perinatal mental health. If you'd like to connect with Dr. Flores-Carter, she is on LinkedIn, Instagram, Facebook, and Twitter, and I'll have all of her connections on our show notes. If you'd like to listen to more episodes of the Mom in Mind podcast, please go to www.mominmind.com, where you can get links and subscribe to your favorite listening platform. Thanks for being with us. Until next time. Thank you for joining us today. If you or someone you know is having a hard time, help is available. Please look for resources for help at momandmind.com. Also, please subscribe and share this podcast. Together, we can support moms and families so that no one has to deal with this alone. Thank you for being a part of the Mom in Mind community.